If you are not speaking and can stay on mute, that would be helpful to the audio. We are now streaming live on YouTube, and we'll get started in just a few minutes.
Mercedes, this is Gwen. I'm going to apologize in advance. I have closed my door for my dog, but he's outside barking. I think if I just let him in, he'll behave better. So I'm going to do that. If that becomes a problem, I will figure out another solution. I apologize.
That's okay. We love our fur babies on video, so no one has complained yet. It's still morning. Good morning, Senator Sweeney.
Good morning.
We're just about getting ready to start. We'll start promptly at noon. We have all our speakers lined up and on the call already, and I see a lot of other folks joining. And we are live streaming on Facebook and YouTube.
Great. Great. Seems like it's been a long time coming.
And we're here. Thank you. We expect about 40 to 50 on this platform. And again, we are live streaming on YouTube and Facebook.
Hello?
Can you hear me?
Yeah. Hello?
Hello.
It's Assemblyman Hotown.
Hello, Senator. How you doing?
Good. How are you?
I'm very good, thanks.
Hi, it's Assemblywoman Carol Murphy. Hope all is well.
Thanks for being on the call, Carol.
Thanks for inviting me. This is great. Thanks.
And it's Assemblywoman Annette Shapiro. I know he says Annette.
Yes.
That's one word says it all, Annette. That's all you need. Everybody knows who you are.
Okay, we've got 1 minute to go. So good to see everyone coming on to this platform.
And there's Tom Kane in a tie and a jacket and me in a t-shirt.
Yeah, as always, Steve, as always. Good to see you all.
So,
Okay, we're at the top of the hour. Senator Sweeney, we can get started. Thank you.
all right. Thanks, Mercedes. One, I want to thank everyone for getting on the call, and I want to thank my colleagues in both houses and on both sides of the aisle. This caucus is not partisan in any way at all. Several people care about the disabled community. Problem is we just never really communicate as well as I think we need to ensure that we address the concerns of the disabled community. And Mercedes, this is one discussion I know that's very important. Because being in this pandemic, I can tell you, our loved ones are forgotten. Last year when this first broke out, frontline workers absolutely got to get vaccines. Our seniors and disabled absolutely got to get, seniors got to get vaccines, absolutely. We had to really raise hell about the administration making sure that the disabled weren't forgotten as we go through this, that they're as vulnerable as the other categories, and we want to make sure they get treated properly and fairly in this process. So having this discussion, I think, is a very healthy discussion, and look forward to trying to come up with some legislation or at least communication with the front office to address the concerns. And again, I want to thank my colleagues on both sides of the aisle. And in my house, Tom Kane being the minority leader, and I know I see Fred Madden and others. So I don't see everybody in front of me, but thank you for all joining in. I'll turn it over to you, Mercedes.
Thank you, Senator Sweeney. We know that our folks with disabilities are in the best hands when we have you leading this caucus. I talk with people all over the country in positions like mine, and I know more and more how fortunate we are to have your unwavering support. So thank you so much. My name is Mercedes Witowski. I'm the Executive Director at the New Jersey Council on Developmental Disabilities. I also have a daughter with multiple disabilities, so I have firsthand experience on the effects of disabilities on not just on her needs, but on being part of my family. So I know that this caucus and opportunities like this are critical to her success and her quality life. I'd like to welcome everyone to the Zoom session and those watching live on behalf of the New Jersey Council on Developmental Disabilities and the supporting organizations of the New Jersey Legislative Caucus. We're proud, we're delighted and thankful to have worked in partnership with the New Jersey Legislature to form the caucus. When we launched on December 1st, New Jersey became one of 8 states across the country who have some form of a legislative disability caucus. We certainly didn't imagine a caucus in a virtual environment like this, but as I look out my window and see the snow falling, I wonder how many people would be able to travel to a meeting that was happening somewhere else in our state, like in Trenton. So I think that this opportunity gives many, many more people the opportunity to participate. And although it's a new platform for us, even in the last 9-10 months of doing this, we certainly want to make sure that you all have the opportunity to experience. There's captioning on this session, as well as sign language interpretation. And if you have a need for those settings, please make sure you adjust whatever you need and let us know in the chat. So it's clear that this caucus will do its very best to represent 1 in 4 New Jerseyans who identify with some type of disability. There are many issues on the minds of people with disability, like employment, income, security, transportation, housing, education, education through the lifespan, early intervention to age 21, and those transitions out of school to adult life, access to healthcare and quality supportive services, and a quality workforce that many of you have supported. But today we've looked to focus this discussion on COVID-19 and its impact on the disability community. We know that the pandemic has really taken a disproportionate toll on people with disabilities. We learn that people with disabilities are more likely to have underlying medical conditions that puts them at greater risk for severe illness from COVID-19. Having a disability, we've learned it makes it harder to practice social distancing and wear a mask. Additionally, most of us rely more heavily on smartphones, computers, and internet access and platforms like Zoom to continue to meet with each other and obtain critical information. And what we at the council and many organizations have found that if you don't have a smartphone, computer access, computer or internet access, think about how much you would be missing out on and what critical information would never reach you. Let's think about how individuals who lip read were impacted by required mask wearing, or how challenging it is to hear what people are saying when a face mask muffles your words. What about people who rely on caregivers to get out of bed in the morning, but those caregivers can't report to work because they have children who are no longer going off to school? There's so many cascading negative impacts for people with disabilities. And if we don't speak with people with disabilities and their families to understand that those impacts, then we could all be working very hard, but not hitting the target. And I think this caucus is our attempt at hitting or getting so much closer to the target. So we've lined up a few speakers to start this conversation and share their views. We've encouraged, we are now encouraging those of you that are listening, either through this platform on Zoom or on YouTube, to please share your reactions, your comments, and your questions so that we can incorporate that into our discussion today. After each speaker, we'll open up discussion from Legislative Caucus members and their staff who may have joined with us today. This session is being recorded and it will be available to share reactions and comments and questions even after today's 1-hour event. Even within the topic of COVID-19 and the disability community, we couldn't possibly cover all bases in an hour. So we're focusing today's hour on two more specific areas. One is on COVID-19 and its challenges around access to critical care resources, access to testing, personal protective equipment, and vaccines. And after that, we'll spend some time talking about COVID-19 and its impact on the educational system for students with disability, including loss of therapies and behavioral supports and the transition for students who are about to graduate. So please join me in welcoming our first set of advocate speakers. To start us off, I'll introduce Gwen Orlowski, Executive Director at Disability Rights New Jersey. She'll be followed by Annette Smith, a parent advocate, and Steve Groslavic, a self-advocate. Gwen, welcome. Gwen, you're on mute, so let's unmute and then start back up. Thanks.
Thanks, Mercedes. The challenges of the technology. Good afternoon, Senator Sweeney and members of the Legislative Disability Caucus, and thank you for the opportunity to speak about New Jersey's allocation of critical care resources during a public health emergency model policy. My name is Gwen Orlowski, and I'm the Executive Director of Disability Rights New Jersey. Disability Rights New Jersey is New Jersey's designated protection and advocacy agency under federal law, and we investigate allegations of abuse and neglect and advocate for the rights of individuals with disabilities. Early in the pandemic, concerns arose in the disability community about access to critical care resources, like ventilators, should there come a point where the demand for critical care resources outstripped the supply. This was a significant concern in the spring, as New Jersey had no policy. At Disability Rights New Jersey, we worked with advocates across the nation on this novel issue to make recommendations to the governor and the Department of Health to ensure that the state, number one, had a policy, and number two, that the policy did not discriminate against individuals with disabilities, either expressly or in practice, meaning that the guidance or policy was fully compliant with civil rights laws. Throughout our advocacy, we stressed the centrality of having individuals with disabilities, their families, and advocates participate in the development of that policy. The state of New Jersey issued its first guidance in April, and then the revised model policy on December 16th. The revised model policy provides a 3-part framework for healthcare facilities to choose to adopt the model policy. First, it sets forth a framework to create triage teams headed by lead physicians along with a nurse and administrator, all of whom have experience caring for patients in critical care units. The model policy emphasizes that clinicians treating patients should not make these decisions. Secondly, it describes an allocation framework for making these decisions based upon a 2-part score. The first prong focuses on saving lives, prioritizing patients who are more likely to survive critical care. In other words, an individual's short-term survival likelihood. The second prong prioritizes individuals not likely to die within 5 years. In other words, a focus on longer-term survival. The framework also gives priorities to those working in the healthcare system as well as younger individuals. The third prong provides guidance for reassessment of ongoing critical care cases. And in addition, the model policy includes an appeals process and special rules for pediatric and neonatal allocations. It is important to note again that whether a hospital chooses to adopt the allocation policy is a decision made by each facility. However, the Attorney General Law Enforcement Directive provides that healthcare facilities and employees who adopt the policies are immune from criminal prosecution, and a revised executive directive issued in December provides that healthcare facilities that adopt the revised policy and their employees are also immune from civil liability. Disability Rights New Jersey continues to have grave concerns about the disparate treatment of individuals with disabilities under the revised model policy. Since April, we've brought our concerns to the Department of Health, and while some positive changes have been made, we will continue to bring our concerns to them. Throughout the country, advocates in more than a dozen states have filed complaints with the Federal Office of Civil Rights, and resolutions have been achieved through that process to bring states' policies into compliance with federal civil rights laws. The newest OCR resolution dates from just last week, January 21st, and we at Disability Rights New Jersey are analyzing those resolutions and will again make recommendations to the governor and the Department of Health so that New Jersey's model policy is consistent with OCR recommendations. Thank you very much.
Thank you, Gwen. Thank you for your leadership on this important issue. I'd like to now open up to members of our legislature for reaction or questions to Gwen in the access of critical care resources. If you would just unmute yourself and speak. We don't have any particular order, but I'd just like to hear any reaction or questions. Go ahead.
Sure. Thank you, Mercedes. It's Fred Madden. Hi, Gwen.
Hi.
Gwen, I sit as a senator in South Jersey in the 4th District. Just had a question. You've been advocating since April, is what I heard, and there's been 2 directives put out since April. The one was the most recent. You said in December. Can you tell me or tell us what have you not been successful achieving since April, I guess, through now?
Yeah, so
assuming you made some headway, and that was why we had some updates.
correct.
Could you tell us what's left?
So I think that that's an excellent question, Senator. So, for example, one strong advocacy point in the spring is some of these resources. For example, a ventilator.
Did you put stuff
I'm
on?
just having a hard time hearing you.
Sure.
Somebody's not muted that probably could be. I'm sorry.
I'm happy to repeat. So one issue in the spring was that some individuals use some of these resources, for example, a ventilator in their own personal lives. And if they went into the hospital with that ventilator, there was a concern that if the policies were triggered, if we had a shortage, that their ventilator would be taken from them and given to somebody else who scored higher on the, or actually scored lower. I believe a lower score gives you greater access to the critical care resources. And so right back in April, we said, can you please change that to make it clear that people can keep their own ventilators if they go into the hospital with a ventilator. And that is a positive change that is in the December revision. With respect to the test, the two-prong test itself, and I didn't want to get too in the weeds, it uses common clinical criteria based on organ function to determine people's numbers. And the national advocacy around this and what OCR has said is that that test in and of itself has a disparate impact on individuals with disabilities. And so there are ways to fix that. OCR has given very specific guidance to other states, and they've made those changes. So I should have said this at the beginning. Our policy is based upon a policy that came out of Pittsburgh, the University of Pittsburgh, and many states adopt it wholesale, as we did in New Jersey. So now we have a model from OCR on how we can change the language so that it doesn't have that unintentional disparate impact. I don't think that the state wants it to have a disparate impact. They're very clear about that in their ethical framework, but the devil's in the details, right? And so getting the proper language in the policy is important. And what we're doing right now is analyzing what OCR said last week. And I will go back, we had a November letter, we'll go back and do another letter to the health department to say specifically, these are the changes we'd like you to make. We haven't at this point filed an OCR complaint, but that still remains on the table as a possibility.
Gwen, I would like to see that stuff because, you know, we're happy if the administration is doing it on their own, but we have to ensure that it gets done. So again.
Absolutely, Senator. We're happy to
Thank you.
send all of that
Thank
to
you.
you.
Okay. And Steve, you'll share that with the members at the.
Yeah, I'll share it with everyone because this is not a partisan issue, but this is the purpose of calls like this.
Yep.
To make sure the unintended consequences don't happen because they do happen. We know that. It's just we'd like to try to be proactive in avoiding crises like this because this community, you know, this community is the last ones looked at all the time.
Yep.
You know, so we want them to be in front of the line with everyone else. Thank you.
Thank you so much. I'm happy to share all that. And the one last thing I would just say is we have asked if individuals with disabilities, their families and advocates could be at the table for the conversation. It's one thing to send letters. It's another thing to be able to actually have that conversation. And, you know, we are hopeful that that will happen as well with the Department of Health.
Thank you again, Gwen. Unless there's other comments from the legislature, I will pause a second and then move on from that topic to introduce Annette Smith, who will be speaking around vaccines. Annette, welcome.
Thank you, Mercedes, and good afternoon to everyone. First, want to take a moment to say thank you to our legislators for being here today and offering this opportunity for me to express my concerns regarding my reluctance in taking the COVID-19 vaccine. I'm here today as a working class African-American who wears many hats. I am the mother of 2 adult daughters, caregiver of my younger daughter, Tiffany, who's 37 years old, lives at home with me and has multiple disabilities. I am also a grandmother, great-grandmother, and an advocate. When COVID-19 was first brought to our attention, there was no cure, and I, like many others, was immediately concerned about the health of and safety of my family and friends. We stayed home, followed all the directions, and only left home when it was absolutely necessary. I watched the news, spoke to family and friends and other professionals to keep up with the latest news on how things were going. And of course, like everyone else, I became more concerned as the death tolls rose. Months later, there were conversations that began around possible vaccines. And again, the concern was who were the folks that were being included in the testing and what were the side effects and long-term, short-term side effects. And my next thought was I need more information on the after effects of this vaccine before I can make any decision for myself or Tiffany. It seemed that after a short time, there were some studies on volunteers, the healthcare professionals, including doctors and hospital workers. The vaccine then became available to what they call Group A, which includes seniors, 65 years and older, caregivers, people with disabilities, individuals, and other individuals with compromising health issues, and first responders. My daughter Tiffany is eligible because she falls into two categories. One is a person with disability, and also being a person with compromising health issues. I am eligible as a caregiver and also being over the age of 65. But I'm not ready to jump in line for the vaccine at this point. One of my concerns is, with new experimental medication, as an African American, we have been, our guard goes up and when there's new treatments and who it's being tested on, because the first thing most people refer to is the Tuskegee experiment that happened back in the 30s with for over 40 years with Black male sharecroppers who were injected with the syphilis and they were experimented on. And they weren't even aware that what they were given or what the after effects were. And for years, they were not given any medication. They were just left to deal with the after effects of this disease. And over the years, we know that they've always, back during slavery, there were gynecological experiments that were done on African-American women without any anesthesia. And because it was believed that Black people didn't have any feelings. So, and there were some other studies that I came across as I did some research on young Black males with aggressive behaviors that were, families were given monetary incentives to allow their children to be experimented on. And the last one that I came across just this past weekend was an experiment that was done on people with disabilities back during from 1929 through 1976. It was about 7,000 people that were forced to have sterilizations, and many of those folks were African American, poor, and disabled. So I say all of this to say that with most African Americans are reluctant to jump in line for this medical treatment of the vaccine without any more data. I did this weekend a small survey on my own of friends and family members and some professionals as well on what their thoughts were around the vaccine. And it was 27 people that I interviewed. And right off the bat, 3 people said that they would take it. 6 people said absolutely not. And the other 18 were on the fence, and mainly because they haven't had much research. Amongst the folks that I did interview, one was a young woman who's a medical doctor in the emergency room, and she has taken both parts of the vaccine because she has witnessed the horrific side effects of this virus, and mainly with watching how people have had horrific deaths from this virus. And she, her biggest fear was bringing this home to her children and her husband. Now, her husband, on the other hand, is waiting before he takes the vaccine for more data. I also spoke to a family friend who's a chemist and works at a pharmaceutical company. Now, she said right off the bat that she advises her family and friends to just wait for more data. One of the things that she did bring to my attention was that one of the things that African Americans need to be concerned about is their level of vitamin D. Having low levels of vitamin D is something that's common with a lot of African Americans because of the lack of time that they spend in the sun. So something as simple as having your vitamin D level checked before you take the vaccine. And if it is low, she recommended that you take some supplements until you bring it up and be tested before you do have that vaccine. This to me seemed like a simple thing, but I had never heard that before. And again, this brings the reluctance to take the vaccine back to the forefront for me again, because my concern is the long-term effects. I want to be safe. I want Tiffany to be safe. I want my family to be safe. But I think that more information needs to be presented to the general public, African Americans, so that we are aware of the side effects and what we're stepping into when we do decide to take this vaccine. So in the long term, what I'm asking is that more information be presented to folks who are reluctant to take the vaccine so that we can all return back to a more normal life. And I thank you again for your time.
Thank you, Annette, and thank you for sharing with us. I'll open it up to the legislators for reactions and comments or questions.
Hi, Annette. This is Senator Vitale. Thank you for your comments. I think that your concerns and your observations are not invalid, right? So we know the awful history of the Tuskegee experiments and what that meant to hundreds and not thousands of African Americans, and just awful. And so I want to just sort of jump forward to the science of these vaccines. So the two vaccines that are available, both the Moderna and the Pfizer vaccine, are 2 doses, 3 to 4 weeks apart, and they're being. And the suggestion is that everyone who is able to get a vaccine get the right age, the right group, and so I can only say that from my experiences, a legislator and chairman of the health committee and someone who's done quite a bit of research, that the vaccines are effective.
Senator, we're having a little audio interruption here. I'm not sure if you can adjust your microphone, or there might be some connection issue.
More than the vast majority of people who receive the vaccine do not have a reaction. I had a friend who received their vaccine a couple of weeks ago, well, sworn to where the injection site was, and that was it. There are others who maybe gotten a fever, or it'll last a half a day, then feel weak for a day. But that's a personal effect that people will get. But it's usually they're usually in the minority of individuals, and again, they're very light reactions. Some people don't get any reactions at all. But your comments about the African American community being reluctant based on the history, again, not without merit. And so I think that the state has its work cut out for it. I know that in my district, in some of the urban areas, whether it's African American or it's Latino, there is a greater reluctance or say not a misunderstanding or not a full understanding of what the vaccine can provide for people, the protection and what their risks are. So we have our work cut out for us, no doubt. So we hear your message loud and clear, and we need to do a better job, particularly in communities of color, where this really matters. So thank you, Annette.
Thank you.
And it was just a report. I read it today that 30 to 50% of the DSPs were going to get vaccinated, and that's it.
Mm-hmm.
So obviously, the level of communication, and to echo what Senator Vitale said, the distrust absolutely understood in the minority communities, but we really have to work hard to get over that, because our DSPs are the ones that are coming in, taking care of and interacting with our disabled community. And, these are the most vulnerable people. So we, as Senator Vitale said, we have our work cut out, but it was very alarming to read that report today that 30 to 50% are only willing to get vaccinated.
Yeah. And I have two caregivers that work with Tiffany just about every day. And they're coming on board with taking the vaccine, which I'm happy about. But again, I can understand their reluctance if, they have questions about it. They're very super protective of themselves and my daughter as well. So I appreciate that, and I do understand.
Annette, hi.
This is Lou Greenwald. If I could just, I'm sorry, could I just add something?
Yes.
So I'm so thankful for you sharing your personal story. And I think, as I can't put myself in your shoes exactly, but all I can do is share with you and maybe give you some, I think it's incumbent on us as legislators to try to penetrate this and to offer hope and to get your confidence level to where you're comfortable getting the vaccine. So, well, your story is very important to me because it not only helps bring a personal face to our history and what causes the fear, but hopefully how we can help overcome it. So let me share with you, as a father, I have a daughter who suffers from epilepsy and from a neurological condition called POTS. And she's, I know we all have problems, and I would tell you that my daughter is thriving. She's in her first year of law school, and it's a condition that she battles, but it adds, because of its impact on her neurological condition and the impact that COVID has on the neurological condition, is something that if I could get my daughter a vaccine, I would drop everything I was doing to get her in line to get the vaccine. So I say that as a father. Obviously, as a white man, and my daughter being a 23-year-old young white woman with these conditions, I know it's not an exact example, but I would tell you, as I've governed from life experiences, if I could do it for my child, I would do it for any of yours and for you. I think the other thing is that we as have an obligation, and I would like to offer, I would like you would be comfortable calling us privately. I'd be happy to have a conversation with you further.
Sure.
But we obviously have members of our caucus. Dr. Herb Conaway is an African American. I think he has gotten to a very strong comfort level with this vaccine. Its safety. I have a wonderful friend, our former commissioner of health, who's the president and CEO of University Health System in a obviously minority community in Newark, Dr. Sharif Ellenhall, and I know he is a strong advocate for this vaccine and has been working with us on getting the vaccine into the arms of people as quickly as possible. And I am worried because you are a frontline caregiver, but if we could get you comfortable with this, you are also a public advocate that could spread the message of why you think it is safe. And I think that would be a very important role for us to play. So I would be happy to do any of that to get you to a comfort level, because I am worried not only for yourself and your family, but we know that a lot of the caregivers that are coming to home are people of color and are in a very vulnerable spot. And getting them vaccinated not only protects them, but their families, as well as helps us get to herd immunity so that our most vulnerable population is protected. So I would be more than happy to do that and have that conversation with you offline and try to put you in touch with the people that could give you the comfort level. And I understand that the only thing that may ultimately get you the confidence and if that's the case, then obviously millions of this vaccine. So thank you for your time. Thank you for your story.
Thank you. I am more than willing to speak with you. Believe me, that is my goal, to spread the word and lift other people's confidence so they feel, good about taking the vaccine. So thank you.
And I think at the end of the day, I don't mean to interrupt you. My concern is if you talk to 30 people, you're going to have 15 that tell you, absolutely, I'm getting it. And you're going to have 15 that are concerned or don't want to get it. So I think really, Steve and Joe and I and many of us have said from the beginning, whether it was in the Trump administration or the new Biden administration, science needs to dictate to us. We have to follow the science. And if we can get that science to you, that may be best information that you have.
Absolutely. Thank you so much. I appreciate it.
Thank you.
Thank you very much. And joining me now is Dr. Amish Adalja, Senior Scholar at the Johns Hopkins Center for Health.
So hi, this is Assemblywoman Carol Murphy. Just real quick, I just want to also just chime in and echo the sentiments of my colleagues. But Annette, I do want to assure you, and I do agree, we do need to get more information out as the information becomes available on the effects of the vaccine and how it's distributed. But I've had a great opportunity over the last 2 weeks to tour 2 of the vaccine distribution sites. One in Stratford at the Rowan Osteopathic Health University, as well as here in Burlington County at the mega site in Morristown. And one thing that I didn't realize, and this is why what you said is so important to remember, the word has to get out, is that in these sites, there is an observation part of the vaccination. And that is once you register and you are administered the vaccine and you make your appointment for your second shot right then, and they put you in an observation place where you sit for about 15-20 minutes and you're observed by medical professionals to assure that when you leave there that there is no immediate reactions to the vaccine. So while we all know that a reaction can happen anytime after a vaccine is administered, but I think, and from my understanding with speaking to the doctors that I was able to talk to when I did tour both of these sites, that a lot of the reactions, one, there is no reaction. They've had a very few of maybe 1 or 2 people who have had reactions only because they have had pre-existing conditions that maybe have been reacted to it, but that's very rare. But they also observe. And I think with that being said, that gives people a little bit of comfort that they're not just being given the shot and then sent on their merry way. There is that observation period that a medical provider will have right after, immediately after the administration of the vaccine. So I think that was a little bit more comforting to me, not only as a legislator, but also as a person who has registered to get her vaccine. And I know, I'm in the last phase of this because there are people who need it more than I do at this point. But I think it's very important to remember that they don't just give you the vaccine and send you on your merry way. There is that observation period within the site. So I wanted to point that out for you as well.
Ready to ask for emergency use authorization, and that's
Thank you all for the feedback to Annette. I know this already has begun, some of the education and some of the additional sense of questions that Annette has. I'm going to ask that we maybe just move to Steve Groslavic, a self-advocate, to share in this particular area before we move on to the next segment. Thank you, Steve.
Thank you, Mercedes. Good afternoon, everyone. Thank you to Senator Sweeney and the rest of the caucus today for giving me the opportunity to talk about COVID and issues surrounding COVID. My name's Steve Groslavic. I'm a Robbinsville resident, and I'm also board president for the Progressive Center for Independent Living. I serve on many other committees that advocate for the rights and well-being of individuals with disabilities. And I'd like to share my perspective dealing with issues surrounding COVID. So the first thing is workers, DSPs that I use every day were eligible to receive the vaccine in Group 1A. That includes volunteer and unpaid workers as well. But the issue was a lot of them had difficulty obtaining appointments because even though the State Department of Health said that no documentation was required, several sites said they needed documentation. So I had to go to the Ombudsman, Paul Aronson, and I appreciate and I'm very thankful for his help with that as well. In addition, direct support professionals received hazard pay, and I believe that that should continue throughout the duration of the virus. And we need to make sure that they're getting paid the correct amount of hazard pay and in an efficient and timely manner. I myself have not received the vaccine yet, and there are several communities and group homes as well that are also eligible for 1A that have not received it. So it seems to be that the organization is slightly chaotic. And as they open up more sites and then open up to more groups, it creates kind of a bottleneck effect where everybody tries to get the appointments and they can't get them. In addition, with the New Jersey Disability Action Committee and Assemblywoman Huddle, we recommended 9 bills in order to support the efforts to combat COVID and to assist individuals with disabilities, such as creating certain committees and easing the manufacturing of queer masks so that people with auditory disabilities have an easier time understanding when people are speaking with them, because the mask, when you read lips, with the mask, it causes a lot of problems. In addition to that, we need to have more data as to who gets tested and what their test results are in long-term care facilities. And we need to ensure that the vaccine is available for everybody that wants it and needs it. The vaccine is a personal choice. I understand if you don't want to take it, but there needs to be it needs to be made available and easily available for those that need it. And another point about the kind of way that this was kind of rushed in a way was they didn't account for people with sensory needs. Individuals with autism, they can't really stand in long lines, and they may need a more quiet area than a corner in a pharmacy to receive their vaccine. So I'd like to see that maybe they can open it up to more individualized health centers as well, just to make sure that we limit the amount of potential COVID exposure to the most vulnerable populations, those with disabilities as well. And I would like for the legislator and the Assembly's support with the 9 bills that Assemblywoman Huddle has put forward. And in addition, I'd also like to talk about the workability bill, because right now, if a disabled individual is on workability and they lose their job, there is no insurance coverage and there's no grace period. So if they get sick because of COVID and they lose their job, there's no grace period. So Assemblywoman Carol Murphy has put forth a bill, A5262, that I believe that, we should support and push for to make sure that people with disabilities who are employed are protected. Thank you very much for your time.
Steve, I would appreciate if you sent or have someone, whether it's Mercedes, send to the Senate the bills that you're talking about in the Assembly.
Okay.
Because we don't necessarily, I know it's hard to believe, but we don't always coordinate as well as people think we do. So, and the workability pieces, we're going to be doing a series on that and actually start looking at government hiring disabled people, because government is woefully behind in that. So.
Thank you.
Senate President, this is Carol again, and Steve, thank you. First, I would be remiss if I didn't thank you, and I saw Norm on here as well, and Maureen is on here, and of course, Mercedes. It was great meeting with you as well. We did put it in. Senate President, I did speak with Kevin Drennan the other day. He's on top of the bill for the workability. And we worked with Kevin Nunes as well, who's a member of the coalition as well as part of my district. But I would want to thank Steve and Norm for taking their leadership role in this caucus as well and bringing it forward to us and giving us the opportunity to help out and to make sure that we also do the right protections for them as well. So Senator President, you did get the workability stuff from Kevin, has it? And we will definitely make sure that Steve and everyone is kept in the loop on this.
I appreciate that, Carol, but as you know, sometimes you were good enough to follow up with the Senate. That coordination doesn't always happen. So to avoid things from languishing, where bills get done in one house and not in another house, always try to find, I'm just giving this as some advice, always find someone in the Senate, doesn't matter Republican, Democrat, but make sure you match the bills up in both houses.
Senate President, if I may, I did introduce those bills in the Senate, so I'm always happy to have co-sponsors. Thank you, Steve, for your testimony.
Okay, we only have about 15 minutes left, but I do think it's important that we include into this conversation the issues around education, special education, and the reactions to COVID. We do have 3 speakers lined up. I don't know that we'll get to hear from all 3. We have 2 parents and Peg Kinsell with SPAN, Special Parent Advocacy Network. I'm going to ask Peg if she's available to maybe start off this conversation at the high level, and then if we have time to maybe hear from one of our parent advocates who were prepared, we certainly will get you their written remarks, but if that's okay, maybe we should move forward that way. So Peg, are you available?
Yeah, can you hear me?
Yes.
Okay, so let me first say that as the policy director for SPAN Parent Advocacy Network, we think that family voices are critically important to this conversation and advocate for such. So I'm going to go as fast as I can to cover some subjects that need about 2 hours worth of coverage. So I'll put out right now any way that we can support continued conversations with the caucus or advocate for additional supports or information. Please let us know. We stand ready to do that. So thank you for the opportunity to speak with you today. I'm the policy director at SPAN, and SPAN is the designated parent training information center for New Jersey. We also house Family Voices, a family health information center, and I work on a military project at the Joint Base supporting military families that have children and youth with special healthcare needs or disabilities. So I appreciate the invitation here. My subject is supposed to be educational supports, transition to adult life, compensatory services, and health and behavioral supports. So the chance of me doing that in 3 minutes is slim to none, but I'm going to take a quick stab at it. COVID's had a huge impact on the well-being of children and youth with disabilities and special healthcare needs, along with their families. Most problems and barriers that are faced daily by these families have been increased exponentially since COVID. We have housed and so many calls and so much input from families tackling all the different supports that may be critical to their well-being, trying to navigate special education, related services, mental health, and family support in a variety of modalities has become a daily struggle. You've all heard the issues about technology support and not being there. We also don't think about the education of families to navigate those technology supports and how that impacts them, as well as just having access to them. And it's also a good reminder that employment, economic, socialization, and anxiety that all families in New Jersey are facing are also faced by those with family members with disabilities. Disruptions to daily life during the pandemic are also taking a huge toll on children's mental health. A recent CDC report said that the proportion of emergency room visits related to children's mental health has rose dramatically for school-age children and adolescents, up 24% for children 5 to 11. 31% for youth 12 to 17. Access to care is critically important because of that. We have minimal ways to address training and coping strategies and supports for family, including respite. Respite and other family supports to support the family members has been a huge issue, a huge deficit. Although I have heard about virtual respite, and nobody's still been able to explain exactly what that means to me. But we stand ready to assist you with ideas, solutions, and advocacy to address these issues and more. This is why the timing of this caucus is so important. Legislation and policy directives that are about students with disabilities and students with healthcare needs need to have the input and expertise of those affected, not just policy wonks, but also families and youth that can give an authentic perspective. When legislation is created without consideration of folks with disabilities, it can be really frustrating to the community. We hope that this caucus will help make sure the question is asked about any newly proposed legislation across departments, domains, and the state of New Jersey as a whole. Simply, what is or what may be the impact on the disability community? And this community does not always agree either, but we should be given the opportunity to weigh in before and not after the effect. Two bills, really good examples, pieces of legislation, but need to be quick, is the bridge bill that still needs another tweaking, and a discipline reporting bill. We are hugely supportive of the disinfectant of reporting publicly to issues that are happening. But a discipline reporting bill that has finally disaggregated data did not include students with disabilities. And it also did not include the use of restraints and seclusion, which has only escalated with the additional behavioral needs for students with disabilities. So those are just quickly some things that we need to talk about. Education services across the board, whether it's, a hybrid situation, remote learning, or in person, has, created its own issues. And we weren't prepared for it. And so we need to be prepared for it next time, hopefully not next time, but in order to make it more substantial education and supports. So I know I'm probably past my 3 minutes. I stand ready to answer any questions, but I'd really like to get an opportunity to speak with the families. This group knows how to get a hold of me, and I'm happy to help with any of your efforts moving forward. Thank you.
Members of the legislature.
Peg, it's Assemblywoman Holly Shapizzi. Being a mom myself to a 9-year-old and seeing how difficult it's been to have the remote learning and, the challenges, even with a child who doesn't have special needs. My office has received a tremendous number of calls from parents in the community who have children utilizing special services, but everything's been remote. They haven't been able to have it in person. They haven't had the respite. And I guess, for suggestions about how we can help, is it something where we look to prioritize vaccinating, teachers and people who work within special services to be able to ensure that in-person type of thing with children who need the in-person, are there any specific recommendations for this moment in time that you'd like us to explore in trying to help out these families?
Thank you, Assemblywoman. I think that there's there's quite a few. One is access to services. There are still families that don't even have the technology or the education or the access to the services they need, whether they're virtual or not. I think that educators, support staff, any kind of related service provider that's working with students with disabilities should be a priority for vaccination, absolutely. And I also think that we have to have a frank conversation about compensatory services. That's part of the issue around transition. It's also part of the issue for a lot of kids. The not just the learning piece, but the reduction of services, the outlet to that socialized piece, and the way of generalizing what they're learning into a community, into a school, all missing. The other piece for kids that are transitioning, their transition year is just really beat up. I mean, any kind of community-based instruction, job sampling, working out in the community, travel training, a host of things they have no access to. And it is just not the same virtually. And not that educators aren't trying to do the job, but we have to figure out a way how to support that, especially at that age, when, you know, these folks are transitioning to adulthood and they need a good starting block to jump off of. So those are just a couple of things, but I certainly am happy to talk to you about a host of ideas that we have at SPAN.
So I want to jump in. My name is Teresa Ruiz, and I'm the New Jersey State Senator who chairs up the Education Committee. So pegged to the disciplinary bill, which is I'm the sponsor of, we are including those amendments that you had requested for, just as an update, and those changes will be made as floor amendments when we vote on the final version of the bill. But to elaborate on some of the things that Peg was discussing, you know, for me to say that I've been happy with the decisions that the department has made during this time frame would be an outright lie. The disappointment in the lack of leadership in the space of education has been severe. Since March, we've been calling on the Senate side for access to technology. And I think up until a month ago, there's still about around 9,000 families in the state of New Jersey that are not connected, and that's deplorable. And when you talk about just the basic things that we're discussing, and then you incorporate the special education conversation in it, it just gets compounded even greater and more. So certainly I would be open and willing to having any discussions. The Senate President and I have already had a discussion earlier this week about how we can alleviate some of these stressors in a way that maybe we build in extra time for this specific sector to I don't know, Steve, if you want to chime in and throw that out there until we explored a little bit more, but how we can alleviate some of this without just losing another year for a lack of better terms. And so, you know, keenly focused and aware, education has almost been a secondary conversation, I feel like, during this pandemic. It should be in a primary platform because it's impacting all families. And that gets compounded if you're a special ed family, that gets compounded if you're an urban or a rural family that doesn't have access to technology and bandwidth, that gets compacted if you're a black and brown family member, it gets compounded and compounded depending on what other levels of quality of life that were impacting you prior to COVID. It just gets compressed even more during this time frame. So in tune, keenly aware, making those changes to the bill, and something that we have to focus on. One thing that I will stress here is that data is critical. And I think I've heard this conversation before, and we need this information because we know that the revenue funding for budget, specifically for education, is not going to be a fountain that's going to continue to run. It's going to be a finite number. If we were to get information back, like where are our children on a social, emotional, bandwidth? Where are they academically? Not something punitive, not something to be utilized, only to look to see where she would make the investments. I think we would have a better blueprint for what our summer is going to look like. School shouldn't end this year in June. We should think about this model of a continuum of care so that we pick up the pieces where we haven't been able to do in person, assuming that the end of June will look dramatically different from today because of that vaccine, because of schools having better resources available, whether it's with the air quality system or setting up issues. But I just have to echo for my colleagues who are here and for the constituency who are here, we need data collection for the purpose of how we're going to make the investment so that we know truthfully who New Jersey is, who we are, and where we need to put our money where action needs to be taken.
I just want to add one thing to what Senator Ruiz just said.
You're muted, Senator.
You muted yourself, Steve.
Sorry. Along with what Senator Ruiz just said, I'm really concerned about children, all children that have lost a year to 2 years of education. But most importantly, not most importantly, but it's even more highlighted when it comes to the disabled because our kids are going backwards, and that's the concern. So the senator and I are looking at where we're trying to figure out how we could you could elect to leave your child back a year if we can physically accomplish that. There's physical issues with doing that too, with school districts, but we recognize that kids didn't get the education they got when they were in person. And, and our kids, they require a lot more one-on-one, a lot more intense educating. Because I say this all the time, just because someone has a disability doesn't mean that they're not able or they're not deserving. They're deserving to have every opportunity in the world to have as normal a life as they possibly can, and a meaningful life. And, employment's a big part of that. So education's important. So, Mercedes, this conversation, I know we're kind of at the end of it right now, but I'm thrilled with all the members that are on this call. Like, now that I know Senator Corrado has those bills, I'm going to reach out to her, and we're going to listen. Communication makes a lot of things work better. And I look forward to continuing these meetings so we can actually start to make some progress. We talk a lot. Progress isn't as we talk a lot is all I can say. We need to have more action. So
Before we shut up, I just wanted to jump in before I'm sorry, if you may. This is Assemblywoman Annette Chaparro. I'm on the 33rd District. My hometown is Hoboken. And I just wanted to piggyback off of what Senator Ruiz and Sweeney are saying. We know the saying, it takes a village. And I want to also point out that's important. The minute I was asked to be a member of this caucus, I said, you had me at hello. But I immediately called a mother in my community because I would not know where to start. And she gave me an earful of her struggles. She has two young men with autism, twins. So you can imagine that. And one of the things that really struck me, and I think this is something as a caucus that we should really look into, we could do all the work we want in the state level, but I think it's important that municipalities and counties also have a place where their residents can go to and help them. Because as she pointed out, there are many resources out there, but a family, a parent that's taking care of a disabled child, it is so much work to start searching for resources. They don't have that time. They want to reach out to someone locally to tell them, these are my struggle. As a community, we should be able to know what our neighbors are feeling and what their struggles are and come together. And I think that's important to make sure that local municipalities, counties, that they come together to relieve also the state and help the state out how we can equally put this out, because we don't know the data. I'm ashamed to say, I don't know the data of my district, how many families are impacted and what are their needs. And that's going to be my role to make sure that I get that data. So I just wanted to throw that out there so we can all work together and make this really impactful for our communities, for all of our communities.
So this was certainly such a robust conversation, and we could go on, and we know that. And Bree Latini and Susan Colacello, I am so sorry that we didn't get to hear directly from you, but we will make sure that we put you in touch with these legislative leaders who want to hear your personal stories as well. These are topics that, again, we could have spent a lot more time on. I'm glad that we had this opportunity. I'm ecstatic about the level of legislative support around this Zoom platform. There are 3 more caucus meetings scheduled for this year. I know that in the area of employment, Senator Sweeney, the next caucus will focus on employment. So we look forward to that conversation. If you are are listening and you are a supporting organization or an agency that's looking to become involved with the caucus, please go to the website that we hope you'll see up in the chat. It's njcdd.org/legislative-disability-caucus. There are ways there that you can sign up as a legislative member, adding to the great host of legislators already engaged in the caucus, supporting agencies. And then there's forms for individuals to send in information that they'd like to share with members of the legislature, and ways to sign up for additional information. So thank you all. Senator Sweeney, I'll leave with last words for you, but I really appreciate everyone's involvement and engagement today.
Mercedes, I just want to echo what you said. I think this was a great start. Obviously, it shows you we got a lot of work to do. But the good news is you got the attention of a lot of legislators that are caring and want to help this community. You know, it's how I got started in politics. So it's amazing what you can do when everyone works together. And clearly the great thing is this is bipartisan, and disabled issues never are partisan. So we're gonna get focused and get some things done. So thank you.
Thank you. Have a good day, everyone.
You too.